Lisa Richards, work at St John of God in Subiaco, which is one of the largest private hospitals in Perth. I've been nursing for 30 something years and stomal therapy nursing for 10. It's always the most obvious issue with our patients is, of course, acceptance of often their diagnosis and the fact that they're going to have a stoma. Many patients are actually more ready to accept their cancer diagnosis than they are the fact that they've got a stoma. It's so much more of a mind-blowing issue for them. And a lot of our older patients, they've known someone that has had a smelly bag 20 years ago, and is trying to reassure them that we will help them every step of the way. The new appliances are brilliant. They're not like the old appliances. They all have filters. They all work so well. If we get the right bag on the right stoma, there will be no problems. So it's just reassuring them. And also, if they have any problems, come back and see us the minute they think they've got a problem. Don't wait and think you can sort it out yourself, because that's what we're here for. Actually, probably one of the other problems we have pre-operatively now also is the habitus of the patient. We've got lots of bariatric patients with bellies where sighting is an issue. So post-op, that reveals itself, how much of an issue that might be. So with some of our bariatric patients, we have issues in the initial phase of getting bags that work well, get bags that stick well, that don't leak, that the patients can manage. Once we get them to that point, we also have community nurses. So when the patients first go home, we reassure them that a community nurse will come every day for up to 2 weeks post-discharge. And I think once the patients have started doing things themselves, a lot of the fears are really allayed. Like they're just so worried pre-op, they just don't think they have the capability. And then once they start doing it, it's like, oh, it's not that bad. And we're going, this is what we've told you. So yeah. So often it can be skin issues, and especially with our patients that go into chemotherapy, sometimes things change, their output changes, they start reacting to products that they weren't reacting to before, not necessarily allergies, but just skin reactions. So that can send them back into us. We also have problems of dehydration big time with patients who have chemotherapy, and also blockage if they don't do the diet properly. So they are the main things that we get calls for, or patients coming back in to see us about.